the perfect time to focus on your heart health. Staying heart healthy actually starts with you. Dr. Emil Thattassery is joining us this morning from Kaiser Permanente to give us some tips on how we can begin to take care of our heart. Good morning.
Good morning.
All right, so Kaiser's going to be at our Be More Healthy Expo, which is coming up soon, with tips for people. So what is it that people don't know about taking care of their heart?
Well, I mean, I'll tell you, there are a lot of things. First, it's really just getting awareness out of what we're talking about the heart. The things that we can do are really the simple things, the healthy lifestyle. So that's going to start with diet, exercise, maintaining a healthy body weight. Specific to diet, that's really going to be the things we know about, a diet high in fruits, vegetables, nuts, white meats such as chicken and fish, whole grains. That diet has consistently been shown to reduce your risk of heart disease. So I'd start there.
What about people who say, you know what, I'm not overweight, I'm not obese. What's wrong if I have some red meat, or what's wrong if I like a lot of sweets with the sugar in it?
Well, that's a great question. That's a great question. I'll tell you, for sugar specifically, we know if you have diabetes, that can certainly worsen your diabetic control. And if you don't have diabetes, it can lead to weight gain and problems with obesity. There was actually a recent study just published last week in the Journal of American Medical Association that said that actually the people in the highest intake of sugars actually had a 30% increase in the risk of heart disease.
That's pretty scary.
That's a big deal.
Significant.
It's surprising. Most of the sugar in that study actually are from things like sodas and sugared fruit juices. So.
Okay. Not the fruits and not the fruits. Those are the natural sugars. You can have those, right?
Of course, of course. So fruits don't count.
Is there a particular age range that people should be most concerned about their heart health, or is it never too early to start thinking?
Well, I'll tell you, it's never too early. So really getting in the habit of eating healthy and exercising, it's never too early to start. I think, we know that heart disease starts later in life, but the main thing, and I'll tell you, one of the top three things we know directly cause heart disease is going to be smoking, cholesterol, and blood pressure. So smoking, if you're smoking, really the main thing is to quit. That's more important than everything we just talked about. For cholesterol and blood pressure, there were actually brand new guidelines that just came out a couple months ago from the American Heart Association, and there are big changes there. So I would recommend anyone that's listening to talk to your doctor, see if those changes would apply to you.
And if you have more questions, you can talk to the folks at Kaiser, because they are going to be at our Health Expo. We get all the great information that you need to find out what kind of tests you need to take and what you need to ask your doctor. That is happening next Saturday, March 1st. It is at the Convention Center downtown. It's from 10 until 5, and admission is free. So make sure we see you there. Coming up.